No boundaries.
Yes, ladies and gentlemen, welcome back. Another episode of the No Boundaries crew. We up in the building on this Throwback Thursday. Hope you guys are all having a wonderful day. We rocking, got the crew with us.
What
Deacon Saeed,
up?
what up, Z?
Peace, peace. What's good?
Tata, what uppers?
What up?
Juan Fuego.
What's going on?
All right, man. And as you guys see, we got an extra person in the building. Tata, you want to do the honors in introducing our special guest?
Well, we have the one and only.
You, honey, and I'm
Yeah.
here to give you some truth.
Okay.
Okay.
Do you, honey? Do you still on the scene? We got Miss Kimberly Coffee, also known as Auntie Kim in the streets. You know what I'm talking about? She's gonna give us some information on dealing with the mental health during the pandemic.
Right.
So,
So, Auntie Kim, let's get a little background from you. And what do you do? Like, what is your profession?
My profession now, I'm a clinical therapist. I'm a mental health therapist. And right now I'm working with the acutely homeless, the chronic homeless. And I work for an organization, which is a pretty big nonprofit. We do housing first. So the population that I work with are normally substance users, plus they've been homeless for like a really, really, really long time. And we find them places to live. We subsidize their rent, and we try to reacclimate them into society. But because they've been homeless for so very long, you know, I didn't realize it until I started working with this population. It's not like riding a bike. It's not like you get on it and, you know, your feet knows what to do and that kind of stuff. No. I have 25 people on my caseload. And I'm going to tell you, possibly 75% of them still live like they're homeless.
Wow. So how long have you been with this company again?
A little over a year.
Okay. So you've got your feet wet in seeing the structure and everything like that.
I don't understand what you mean, the structure.
So the structure of understanding the mental health, the homelessness, this is not like your first rodeo.
Right. No, this is not my first rodeo.
Right.
I've worked in human services for almost 30 years.
Gotcha.
I've worked with populations in the juvenile halls. I've worked with transgenders. I've worked with transgender sex workers, male sex workers, female sex workers. My list is pretty long.
Wow.
Can you help me understand when you say they still live like they're homeless?
Well, what I mean by that is, you know, homeless people pilferage, and they dig in the trash. And they just pick up like these odd and end things, like what we would possibly sit outside our home for a special pickup, you know, the big trash truck that comes.
Right.
They'll take that and they'll put it in their little encampment. They pick up stuff that you and I would never even, you almost have to see it to believe it. I actually have one client, and we're trying to clean up his house right now. His house is so cluttered with trash, but trash to him is, these are his possessions and he holds them tight. And he suffers from bipolar 1. And because of that, I have to be really sensitive with him when we start talking about downsizing and decluttering. Because of his mental health, he could be triggered by anything, and anger is a really big deal with those that suffer with bipolar 1. And I don't want him to get angry, because once he's escalated, it takes a whole lot to de-escalate him.
Right.
So when
why do you feel like you say? Why do you feel that they continue just to random things. They put random things in their basket or their homes, and they just
And they're
collect
homeless.
random things. Why do you think that is?
Well, I'm gonna tell you why it is. Based on my professional opinion and my professional history working with different populations, subpopulations, it's because somewhere in their life they lost control.
Mm.
Somewhere in their life they lost control. And so holding on to these possessions, which looks like trash to me, is um, priceless or precious to them. You know, I had one lady on my caseload when I first started with this nonprofit, and actually the name of the nonprofit is Step Up on Second, and it's been around for a very,
Just
very, very long time.
say it one more time. I
And
didn't catch that.
the name of the organization is called Step Up on Second,
Okay.
and they've been around a really long time. And so when I first started working there or here, I met a lady who had been in her apartment for maybe, I don't know, a couple years. And I asked her, could she share with me, you know, some of her history about being homeless so I could be more empathetic, because I don't know about being homeless. I know
Right.
about a lot of things from personal experience, but homeless, I don't know.
Right.
And so the woman explained to me, she was very nice, and she explained to me that she um, didn't even use her bathroom the first
Wow.
few months she was in her apartment because
Wow.
she was so used to going in the bushes.
Mm.
She didn't sleep in her bedroom because she was so, it was too enclosed. It made her feel claustrophobic because she's used to sleeping outside. You know,
Damn.
um,
Wow.
she's still bringing in trash and, you know, letting food go moldy in her kitchen because this is the life she led for such a
Wow.
long time. And it was a series of events that got her there, you know. And
Right.
so over the last year or so, we've worked with her really well, and she's doing much better. So when I talk about somebody that's homeless, when I talk about mental health, it doesn't necessarily have to be that they're homeless, but mental health for all of us, the mind is can play a trick on you and you never come back to reality.
Ain't
Right.
Right.
that the truth?
You
Uh,
know, and people of color, we see mental health, oh, you crazy, man. I'm not doing, you know what? It's not even about that.
right.
The answers lie within. As a therapist, I just help you bring them out. I
Mm.
don't tell you what to do. I only give you suggestions. Um, I go to therapy myself because I need somewhere to dump my stuff. You
Right.
know, when I talk to my clients on a daily basis, it's like they're puking on me.
Mm.
You know, all this poison stuff. You know, I deal with people that have schizophrenia,
Mm.
you know, different personalities. I deal with people that hear things and we can be in the middle of a conversation and all of a sudden they're like, Miss Kim, do you hear this? No. And I have to wait for that to pass if it does, you know. Um,
Man, that's sad. I mean,
Yeah.
to hear this is sad, because this is not something that us is used to hearing about.
Every
Right.
day.
And to hear it from a professional to say that, on a daily basis, I'm dealing with schizophrenia, bipolar,
Right.
people that really have mental issues, and to understand like this is not a game, this is not a joke, this
not.
is serious,
Right. But first,
and it
real
is.
quick,
It's sad.
yeah, Auntie Kim, I want to commend you for the job that you're doing.
Yeah.
Definitely. I know it
Oh,
takes
thank
a
you.
person. Oh, for sure. I know it takes a person with a big heart and to do that job. I work in special education in high school, at a high
Ah,
school. So for me, I could understand a little bit what you're saying as far as dealing with those kind of issues. And on the mental health side, you mentioned something, people of color, like definitely that's something that we don't, especially therapy. We might go to church, we might say, oh, we gonna pray on it. But for me, I think that, like they say, faith without works is dead. And I think that just praying is not enough. Sometimes you need to talk to somebody.
Mm-hmm.
Sometimes you need to get stuff
but
off your chest. There was a young
it's
brother in
cultural.
LA who just actually died to suicide. and he had been dealing with a lot of mental health issues. Talking to his dad, when he was talking, he said he had been dealing with a lot of things for like a year. So this wasn't like him dying to suicide wasn't a big um, I don't want to say it was a shocker to them because he had been dealing with it so long. But I say all that to say is like every time something like this happens, we always say check on your people, make sure you're talking to somebody. For us, I think it's huge that we're doing this on our platform, as big as it is or small as it is, because I think a lot of people are dealing with these things, but they don't have the outlet. And when you don't have the outlet, you get to the point where I think you get to the point where Miss Kim, Auntie Kim is saying, where you get to those points where you might lose the sense of reality and get to a place where you're not uh like I said, dealing with reality, and you end up on the streets. And a lot of us think of homeless people as, oh, they just tripping or something. You never know what these people are dealing with to get to that point. And like, see, I thank God for Auntie Kim right now, because what she said was she had to get to learn to be empathetic or sympathetic to these people, because if you aren't, you think like everybody else think, oh, they just need to work harder or they need to get off their ass, and it's not. To rip for real, it's just not that simple.
It's not. So,
And
Auntie Kim, let me piggyback off of Zaid real quick. Let's take its first step. If and because you were about to go into it, as us as the Black community, the brown community, we have the stigma of not wanting to talk to therapists. It's like, it's taboo type deal.
it is.
So let's take step one. If I'm at the house and I say to myself, man, I want to talk to somebody, can you give us the first step of what, or the what should they do and go about it?
Well, it depends on what frame of mind you're in and what's um, compelling you to want to talk to somebody. Do you want to talk to a professional, or do you need to just like kick it with your bud and share some stuff? That's first off. But when you say you want to talk to somebody, there's obviously a need. There's something some people go to therapy and don't even know why they go, but they know they need to go to a professional, so they go. And that professional will guide them into whatever it is, the root of this thing. I don't know how to explain it. Again, I say this, the answers are inside of all of us, but sometimes they're so deeply rooted, you just need somebody to help you bring them out, and so that would be the first thing. I mean, you can call the crisis hotline. They have uh, every state, every county, every city has a 800 crisis hotline. And from that hotline, they're always going to ask you, do you have an intent to harm yourself or harm someone else? And do you have a plan? If you tell them you have a plan, they're going to ask you where you are, and they're probably going to send the psychiatric pet team to you, because now you have a plan, and it's up to that person to get somebody, a professional, to you so that you don't hurt yourself and you could be put on a 72-hour hold.
It's funny you say that. Like that's one of our lessons at school. That when somebody tells us about, them having or those thoughts, like you have to ask that. And it might sound harsh, like, do you have a plan to kill yourself? But like these are the things that you have to be willing to ask these people. You know what I mean? That are going through this. So that's perfect, Auntie Kim. That's perfect.
So the second step, and let me back up a little bit. Initially, mental health was for rich white European people.
Right.
We didn't get the trickle down for years. And then once mental health became more accessible to all cultures, Black, brown, yellow, each culture has we do like this thing like, oh, we're going to handle this in-house. Oh, we don't tell our business.
Right,
Oh,
right,
that's
right,
going to be a
right.
secret.
It stay in the family. It stay in the family.
Exactly. And you know, and for the African American culture, for most, we do pray. Oh, honey, we're gonna give you to God.
Right.
I'm all for God. I love my God. You know, God is good. I'm a miracle. I've been sober.
Won't he
I've been
do
off of
it?
drugs for almost 28 years. And I went hard in the paint when I was out there, okay? So there is
Talk
a
to him,
God and I am a
Auntie.
miracle. I beg your
Amen.
pardon?
I said, talk to him, Auntie. They need to know. You saving lives right now, Auntie, for real.
I hope so, you know. But the stigma that people of color hold on to is I can't tell my business. Oh my God, what are they gonna think of me? Well, the second step after the first step, when you decide you need to talk to somebody, whatever therapist you're initially assigned to, if you're not vibing with them, you don't have to keep them. You run your own show. You get to say, you know, if you go to Kaiser or Little Company of Mary or wherever you go, you know, to the county, wherever, you get to say, I'm not vibing. This is not, you know, this is not working for me. I need someone else who, you know, may be more empathetic to why I'm here, or a little bit more structured. You know, I need structure, and this therapist doesn't seem to, you know, fit in that well with what I
I have
need,
a,
what I
I have
believe
a,
I need.
I have a question. So to back
Mhm.
up, he asked if he wanted to talk to someone, just a therapist in general. You mentioned there are hotlines and numbers that you can call. With that, you said, if I'm not mistaken, when you call, they're going to ask you what's your plan, or are you planning to hurt yourself? If
Right.
he's not planning any of those and he just wants to talk to someone,
That's
how
fine.
how does that play out with them not going as far as to putting you on a hold? You understand
Well,
what I'm trying to say?
everybody that calls the crisis line is not gonna kill themselves. You'd be
Right.
surprised at the phone calls you get. Sometimes people are just lonely, and the loneliness sits in, and it can trigger major depression disorder. When you're really depressed, when you are majorly depressed, you stay fatigued. Your mind won't shut off. You go into self-guilt. Um, you go into self-blame. You know, those are things that you can work through. Mental health is treatable. It's not always curable, but it is treatable. There are coping and managing skills that I give to the clients on my caseload that are simple. You know, coping with depression or sadness is a big deal. And I let my clients know that it's okay to feel what you feel. You know, I need to validate their feelings, because whether I believe their feelings are false or not, they're yours and
Auntie,
Right.
they're really you.
Auntie, I to go into that, I think when this first pandemic hit, um, I really felt like, you know, you hear about depression and you wonder, how do people fall into that? Like, how do you get to a point where you're feeling this way? And I tell you the truth, I think when the pandemic hit, like after the first month, I felt like I was depressed.
Oh,
Like
that first month.
I felt like I didn't know. I was angry. I didn't know what to do. Like even my wife, she asked, like, she was like, "What's wrong with you?" And I said, "I don't know." Like I really didn't know what was going on with me, but I realized at that time. And then I, like you said, it's a mental thing. So I started working out more. I started trying to, you know, do things
And
to get
exercise
myself.
is good for depression.
Definitely, definitely. And I think that that helped me with understanding, almost like you talk about being sympathetic and you know, empathetic to people. So when somebody says that to me, like I feel depressed, I don't take it lightly anymore. I don't take it out, oh,
Right.
just get out
And
and
you
do
shouldn't.
something. And that's my point. Yeah, you shouldn't, for sure.
Right, yeah.
For sure.
You sure,
Well,
yeah,
my
because
my
that first month was really rough. And to
Definitely.
Kim, no, I didn't call her like,
No,
so,
for real.
Session.
Like seriously.
So Auntie Kim, I know that
Yeah.
you deal with a lot of homelessness.
Mhm.
And so with this, and Zaid brought it up in the pandemic right now, have you seen a difference from before the pandemic and now in the pandemic?
Oh,
Uh,
absolutely.
And tell me
Because
what's been the difference?
the difference is during this pandemic and this 6 feet, this safe distancing or whatever they call it, social distancing. Believe it or not, I call it, I'm self-imprisoned.
Hmm.
I have to keep myself in a space that I'm not familiar with because I'm limited to my movement. And that alone is a culture shock because that's not what the world is used to.
Right. Right. Yeah.
Unless you're an absolute extremist and an introverted or introvert, then that's your thing. But I'm outgoing. I know everybody on this panel is outgoing. So when they shut the world down, okay, I'm in my own self's prison.
Wow.
It's nothing that I did wrong, but this is where I have to be and I have to start to adjust. But my mind
Mm.
doesn't catch up with the real
The
world
what?
Yeah.
Right.
Yeah.
So are your
like it
patients
should.
feeling the same exact thing? They're, that your caseload, the people that you're dealing with, are they feeling the same exact thing?
Some of
Because
them.
I mean, because the reason why I'm asking is like, so before pandemic, they might have been on one level, and of course, like you said, the world has changed for in this pandemic. Has your caseload, your clients, have you seen a change in them?
And
Uh,
some of them, but I also, a lot of my clients on my caseload, they're crystal meth users. And that's a whole nother panel you should talk
mm,
about.
Mm.
Yeah. Mm.
And so they're not really like adhering to all the social distancing stuff. You
Right.
know what I'm
right,
saying?
Right.
They
Right.
just doing their thing. But because they stay high, they don't have to feel like they're in prison,
right,
like they're in
Mm.
lockdown.
Right.
They don't have to think about the reality of the world.
Right.
So everything is good for them
Because I think that's
until
the
they
same
come
thing.
down.
Exactly. Because that's what everybody mad about. And that's why all these people was protesting wearing a mask. Like, you telling me to wear a mask, you telling me to stay inside. It was
It don't
almost
matter.
because this happened, you feel like you're like Auntie said, your freedom was taken away. So like automatically you fighting back to
Right.
truly help us. You know what I mean? If you think about it. But I was
Do
Right.
you
saying
know?
something. Juan, did you have something to say?
Do
It
you
was
know?
it was back
Oh, I'm
on the
sorry.
other question or on the other topic. I just want to know, why do you think it's such taboo for the Black community and how we feel and think about uh, therapy and talking to a therapist? Is it just a pride thing or what? Like why do we find it so, lack of a better word, taboo? Like I don't need, we will refuse to go talk to somebody simply, with no excuse for it or not. You know what I mean?
Right.
right.
Right. Same
It's
thing why black men
cool.
don't go to the doctor. You know what I'm saying?
I don't know what Black man you talking about. I got a point of answer.
You got the geezers.
I ain't been to the doctor since I was in the military. I'm just not going now.
You
Right.
know what? You
It's
stupid.
I'm just saying.
cultural.
Unless
It's
You went
all
unless
last year when
cultural.
you was sick, didn't you?
yeah, and that was only because Trina was like, yo, you're going to the doctor. If it wasn't for her, I would have been taking this Theraflu and been straight.
You know what? I need you to knock it off.
You know what? It's all. You know what? We came here. The Black culture got here not by choice.
Right,
You understand?
right.
So immediately
We
we
really
went
needed some
into
therapists
fight or
on that
flight.
boat, huh?
For
Hmm.
real.
Yeah.
As
And
soon
what
as you got
happens
off, you were assigned to this one,
if
you were
you
assigned
want
to
to
this.
be if you working in the house, if you a house nigga,
Mm.
you automatically had your ears on to the field niggas.
Right, right, right.
Yeah.
And so because of that culture, unfortunately, we're like crabs in a barrel.
Mm.
I see what you got, but I'm gonna get something better.
Right.
And if I have to push you under the bus to get it, so be it.
Right.
It's cultural,
Mm.
you know. And when you talk about mental health, everything we did, our ancestors, we never broke the cycle of don't you say nothing, don't you tell nobody what's going on in this house. You better not say such and such. You understand?
Yeah.
And it
Yeah.
goes on. It still goes on, and that cycle's never been broken. So when you talk about taking, you know, family therapy, for instance, you have to build a rapport. I don't just walk in as these people's therapists. I have to build a rapport with them.
Right.
Because if they don't trust me,
Right.
they're not gonna, there's nothing they're gonna disclose, and I can't help them.
Right. Right. Get
You
it.
know,
I get it.
so
For
it's
sure.
cultural. You know, it is absolutely cultural. And not just for African Americans, but Hispanics. Everything they do is in-house.
Yeah.
You know, you have to learn the different cultures. When I work with Asians, I know that them not making eye contact is part of their culture, is disrespectful. So I don't have to assess them a different way and give them the wrong diagnosis because they're not making eye contact.
Right. Wow.
You know, Native American Indians, they don't shake hands and they stay at a distance because that's their culture. It's not because they're fearful, you know, or hesitant or apprehensive. No, this is their culture. So until we start to learn each other's culture, we can't even begin to understand why people of all cultures, especially here in the United States where we're a melting pot, don't utilize mental health as they should.
Yeah, Auntie Kim, I think that that's
Yeah.
especially in our culture. I think that that's huge. Like to go outside of your family to discuss your problems is like literally like you don't do it. It's almost like you would be disrespecting or dishonoring your family. And I think because of that, and we not getting stuff off our chest, like you said, we just passing it down. We pass it down to our kids. They
Get
gonna get,
angry.
yep, they gonna pass it down to their kids, and
Right.
it's a never ending cycle of why you act a certain way or why you do the things you do. It's some stuff that we do that we don't even know we do. We just do it because we saw our parents do it. And we don't even know
Right.
if it's right or wrong. We just do it. It's some things we say that we just say. And we not, and then when our kids do it, it's not being explained. It's not, so it's like a lot of the cycles that we saw, whether it's divorce, whether it's abuse, whether it's abuse physically, mentally, I say spiritually too, because you could be spiritually
Right.
used too.
Yeah, you
But I
can.
say all that, and it's like, when does it stop? If you aren't able to get this stuff off your chest or discuss the things that you've been through, you just passing it down. You just passing
You're
it down.
exactly right. That's
Facts.
that's the cycle. And you know, you guys, you and Talia are the next generation. You really are. You know, I'm tired of talking. I just do this because I like to do it.
Hold on, Auntie
But
Kim. I'm glad that you said me and Talia, because that means
She's
Pee Wee and Juan
stupid.
are old, right?
look, let me tell you.
I saw
Wait,
that coming.
Well,
I
well,
saw that
at
coming.
least I'm not giving my
we're
money
mature.
away. At least I'm
We're
not giving my
mature.
money away for medical insurance and not using it.
Oh, here you go, man. Hey, I drink ginger ale and take ginger shots. I'm straight.
Not ginger ale.
I drink ginger ale. That's my drink, honey.
Thank
Ginger
you.
ale and cranberry juice.
Thank you. You ain't never been sick in your life.
But ginger ale is not going to cure you, Zaid.
So, Auntie Kim, let me ask you a question
I
since we
can't.
are medical, because this was going to be my next question for you.
Okay.
You know, with mental health and holding things in, how does this affect your physical health with like blood pressure, ulcers.
Very
You're
good
starting to see
question.
people get migraines, and starting issues with the body because of mental health. Can you talk a little bit to me about
Incontinence
that?
too.
Yeah,
Incontinence too. You know what that is,
you're
Zay?
right.
Go
You
to the
know,
bathroom too much.
let me tell you what happens.
I got the sugar.
You
Can't
guys are
stand it.
funny.
I
Let me tell you
can't
what
stand it.
happens. When you have something, let's say you have you were in a long-term relationship and you broke up. As Black people, we try to shake it off. Oh, that wasn't shit. Yeah, I know. I was there, 5, 10, 15 years. Yeah, I'm good. But inside, it turns into like a cancer.
Mhm.
And it's very subtle. So you don't know that you're feeling more fatigued than you normally are. You don't realize that you didn't eat yesterday. You don't understand why you got this headache, and you normally don't get headaches. It metastasizes from the inside out. And then one day some people, and this is not everybody, but depression is one of the worst. Depression will kill because it will increase your blood pressure. It can give you migraine headaches. It can make you want to do things that you never thought you would ever want to do to hurt yourself or hurt somebody else. You know, that
Facts.
is it just metastasizes. That's why I say when you got something going on, either have a best friend that ain't gonna never lie to you or see a professional. And it goes back to when you go see that professional, if you don't vibe with that professional, if that professional doesn't come or present him or herself like you think they should, then you request another one and you go down the list until you find the one that works for you. Because until you feel comfortable with that professional, you're not going to disclose anything. And please don't let your ego get in the way. Oh, I'm only going to tell this much of the story. No, you need to tell the whole story.
And that's so
Because
funny
if
that
you,
you say that because
uh-huh,
it's the same stereotype when we go to the doctor. We don't want to tell the doctor everything. We'll tell the doctor a little bit. It's like, no, I think you need to tell the doctor everything because you
you
never
do.
know.
I mean,
Like I was
how
talking to
do
a friend
you,
of mine the other day, and they were his father passed away because he had a clogged artery, and they didn't know nothing about it. And the fact
mm,
that his doctor, I mean, he didn't go to the doctor and disclose certain things, they couldn't have found this out. So, I'm with you.
exactly,
When you step in, especially now,
right.
we gotta explain everything.
Because there's no gray area. You think about it as pregnancy. You're either pregnant or you're not. You're either having some feelings and feeling self-guilt or something that compels you to go see a professional or you're not. You know, it's like having a venereal disease or whatever they call them now, what sexually transmitted disease. You can go to the doctor, but if you don't tell the doctor, I got a little burn in my pee, they're not gonna
This
check for
nigga.
that.
Right. Absolutely.
Right.
Absolutely.
That's facts. If
They
they don't know, if
gonna
they
give
don't know,
you
they
treatment.
can't help you.
Yeah,
But
I don't see anything wrong with you. Why? Because you're not telling the truth.
and we got it,
Right.
but it goes back to
You're
what
not disclosing. You don't want to get well. Your ego
Can't hear
stops
you.
you from getting well. You better smash that ego and live,
Right.
because depression will kill you. Schizophrenia will kill you.
Yeah.
Bipolar will kill you.
So with these
Schizoaffective will kill you. Anxiety will kill you.
So, Auntie Kim, and I'm glad you brought this up. Okay, so bipolar, schizophrenia, they have medication for this type of stuff. Do you feel that medication is good, or there's another way of dealing with it without medication?
I believe in Western medicine. I'm sorry. Eastern medicine, acupuncture, and the herbs, and the crystals and all that ain't never took away my back pain or my foot cramp. You know what I'm saying? I'm sure it works for some people, but I believe, but for me, medication and mental health, they work. Medication and mental health. Medication and talk therapy. That's mental health. They go together. I take medication. I take psychotropic medications because I have an imbalance in my brain. And if I don't take this medication, oh, be quiet. And if I don't take this medication the way I'm supposed to, then look out, world. Auntie Kim turns into a whole nother bear. Don't poke it. You understand what I'm saying? I believe in medication. I believe in medication. But I also believe that I just can't pop a pill and be good. I have to get with my therapist and talk about the things that are happening in my life. The COVID has opened up doors to mental health like you wouldn't believe, or maybe you would.
Facts.
Because people are having to sit with themselves and they're not used to that. When you have to sit with yourself and your mind won't turn off, you ready to run down the street and hit the back of a truck or something. You don't know how to do that. That's not what you're used to. So mental health, seeing a mental health therapist or being part of a mental health group helps you to manage that, to cope with certain things, to change certain behaviors, to respond differently so that you have a healthier quality of life. I can't cure anybody. But if you come to me,
help.
I can help.
Right.
Always remember that the answers lie within.
Yeah. I think the biggest thing is we definitely have to, you got to talk to somebody. You got to have.
You got to have that outlet for sure.
I don't
have
care.
outlet.
People say, my wife is my best friend, my husband's all that. I get all that. But you have to have somebody where you could just vent. Like, I know it's plenty of times where I call Juan and I just go off. Like, he don't have to respond. You know what I mean? Like, you ain't got to say nothing. Just let me get this off my chest. You know what I'm saying?
Right.
I'll be like, all right, I'll talk to you later. But it's just that kind of thing of being able to really just
It is.
express
I totally understand it because I'll hit her with it and I'll be like, look, I need. She like, well, Talia, you just have to. I don't want to hear all that shit. Look, just listen to what the fuck I'm saying.
Listen, be Auntie Kim right now, not therapist. You know what I'm saying?
Right. I don't need all that. Well, this is Talia. You need to consider that I'm not considering nobody motherfucking feelings today. I need you to listen and hear what I'm saying.
For real.
Well,
that's when I have to de-escalate, because that one to go to the bitter end, and then I gotta follow her, and then I gotta explain to my son why I'm in prison. Yeah, you know what I'm saying? It just Auntie Kim has to pick and choose when she has to be Auntie Kim.
I got bail money. I got bail money.
Oh, you got bail money? Then it's on. It's on the track.
It's on. I love it.
Seriously, you guys, mental health works. And it works because you go in there with an open mind and you're open to a new experience.
But that's if you go in there. But that's if you go in there with an open mind and looking for actual help, right? If you go in there, like we talked about, if you go in there, with, okay, let's say you're going just to appease a group of people that are telling you that you maybe need to talk to somebody, or, you're just trying to feel your way and you're like, yeah, I'm just going to go and see what it's about. And you're not forthwith about what actually your problems are or whatever your issues are. This therapy isn't going to help you.
Your time and a therapist.
Exactly.
It goes back to the STD. You go to the doctor, you want to tell the doctor, but your ego says, they're going to think a certain way about me. Let me tell you something. I go to therapy and I tell my clients, I'm not going to think anything different about you. Everybody carries baggage. Everybody has something going on. You know, couple therapy. I love couples therapy because I get to see them as individuals, and then I get to see them together. And one of the techniques that I use in couples therapy is I statements. I feel like I feel sad or embarrassed, you know, when you say dot, dot, dot. Well, I'm telling you how I feel. I'm not punishing you for what you said.
Right.
I sentences are the best sentences because normally the person that you're talking to will be able to hear you when you say I, not you.
All right.
Well,
You know?
Auntie Kim, so real quick, before we let you go, real quick, Auntie Kim, the organization that you work for, can people donate or help out with this nonprofit organization? And if so,
Well,
how can they do so?
well, it's a really huge nonprofit, and it does pretty good. So donations, no, but what they can do is they can Google it, Step Up on Second. The main office is in Santa Monica, and they've been doing this for a very, very, very long time. It started with a woman and her son, I believe, in Hollywood, and it was just a little house, and now it's just grown into this really big thing. I work at the site in San Bernardino, so I do all the San Bernardino County. Um, what people can do is learn more about mental health and the issues. When you see somebody on the street dirty, talking to themselves, yeah, it could be substance induced, but trust and believe there's some mental health with that. You know, when you see people talking to themselves, like it's a man that like lives in the post office up here where I live. He literally lives in there at night because the doors are open. And he writes every day. I don't know what he writes. I don't know if it's legible. I don't know what it is. But that's mental health. He is actually withdrawn from society. And he lives in his own little world. He bothers nobody. Nobody.
And most of them, they don't. You know,
Yeah.
they're to themselves, and you know, they want to be left alone half the time. But you know, in this world, we do have some ignorant people that
Oh,
feel that it's
absolutely.
funny that, you know, to pick on them and bother them when they're not doing nothing at all. You know, so but Auntie Kim, we want to thank you so much for taking the time out your day to come and hang out with the No Boundaries crew and just
You know
give
what?
your opinion.
I feel so honored.
Thank you, Auntie
Yeah.
Kim.
No, thank you guys. And, you know, if there's a topic that I could speak on, let me hit a sister up, you know. But I just want to tell you what an honor this is. And I hope that somebody, whoever hears this podcast or I don't know what you call it, this Zoom meeting, I don't know. I hope that this helps somebody.
For sure.
I mean,
You know,
this was the whole
somebody.
goal of having you on, is to speak up on this, and you know, all we can do is just talk about it, and like you said, hopefully someone, it's all, if it's just one person, it's good enough.
Right.
You know,
Right.
that's all it takes, is just one that we able to
Absolutely.
help. So, Auntie Kim,
Absolutely.
once again, thank you so much for joining the
Thank
No
you guys.
Boundaries crew and giving us just your opinion. All right, for Tata, Deacon
What's
You guys
up?
Saeed,
be
Juan
good.
Fuego,
Good
I be
night.
your man, Big Pee Wee. We are the No
All right,
Boundaries
little
crew.
funny.
You guys have a wonderful and great Thursday, man. It's Throwback Thursday, man.
Yeah, it's Throwback Thursday.
Thank
Oh.
you
All
so
right.
much. All right.